AM 1240, 95.3 FM, WJON, it's Health Matters, brought to you by Rejuve Medical. My guest today is Kari Collett, registered dietitian, A to Zinc Nutrition. Today, talking about cardiometabolic disease. Okay, so we've moved past blood pressure as far as warning signs. Mm-hmm. How about elevated lipid levels?
Yeah. Well, we talked about this just a little bit, Jay, where if you have elevated cholesterol, things like that, that's a warning sign. It is not necessarily a causative factor, so we have to be careful. But it's still a warning sign. If you have elevated lipids, your body's telling you something's wrong. And I tell my patients most of the time that what that's a sign of is inflammation. There's a reason why those lipids are elevating. And sometimes it's diet related. I mean, we know this, but sometimes it's stress related. Sometimes it's weight related. Or it's all these factors confounding together and just causing inflammation. Your body's not managing its stress very well. So it's trying to gauge this immune response. And in order to gauge this immune response, it's elevating the lipids to make it happen. And it's not working very well.
Right. So when you're faced with those kind of things, you should take that seriously. A lot of times you're gonna go in and you're gonna get your yearly test, or how often you have to go in and find out what your levels are at. Mm-hmm. You see those levels, and oftentimes if you're above, they're gonna tell you.
Mm-hmm. Right.
You got to take that seriously. You got to start making life changes.
Absolutely. And what they'll typically recommend for you is medication, but absolutely, without a doubt, all of those numbers can come down and normalize with the right intervention. Diet, exercise, all the above. And then one of the things that's a little bit misleading about the blood tests that you get from your medical providers, you just get total numbers. And one of the things that we've come to learn recently in the functional medicine world is that it's not just about total number, it's about the type of particles. So LDL we often think of as, the bad cholesterol, but there is a real function for it. It's not bad, it's just we just don't want a lot of it, and we don't want the wrong kind. There are the small dense kind, and then there are the large buoyant kind. And the small dense kind are the oxidated stressed ones that cause damage in your arteries.
So how about some inflammatory markers?
Yeah, so inflammatory markers. So the CRP is a common one for people to have run, like if they end up in the emergency room or something like that, then a doctor can tell you, yep, you're definitely having an immune response. So what's the cause of this response? Same with homocysteine. Yep, that's a marker of inflammation. Those are called acute phase markers. So what we learn is that if you get those run one time, it's a warning sign, but if you get them run again and they're still elevated, then that's really a warning sign. So now you have an acute phase inflammatory marker that is lasting a long time. That's your immune system is overworked and is trying really hard to bring down inflammation. So we need to really listen to that. Those are valuable tests for sure. Right.
How about some vitamin and mineral deficiencies?
Yeah, so a lot of times people disregard this part. They don't do this part as their routine testing, and I think this can offer a lot of information. So especially with the RBC, stands for red blood cell, that magnesium value is far more valuable than your serum magnesium value. And if you are deficient in magnesium at the red blood cell level, you're at risk of all kinds of things. It's time to bump up that magnesium level, and maybe then perhaps we stave off high blood pressure, we stave off diabetes and heart disease all at once with the right dose.
Okay, now let's get to the next part here. This would be the treatment stage. Okay, so we're at a point where, we've identified the warning signs, the risk factors. How do you treat any of these problems that involve your cardiometabolic disease?
Well, of course, with any disease in our conventional medicine system, you can treat it with medication. And unfortunately, what happens then is they treat just one thing at a time with one medication, and all those medications always have side effects. And one of the conundrums, the oxymorons, if you want to call it that, is that if you go into the doctor and you have elevated cholesterol, they'll typically give you a statin. They want to lower the cholesterol to reduce your risk of heart disease. First of all, there's no statistics supporting that conclusion. But second of all, any person who is put on a statin will eventually find themselves with elevated blood glucose levels. So that medication actually causes elevated blood glucose levels. So what do elevated blood glucose levels lead to over time? Diabetes. So sometimes the medication actually speeds up the process rather than slows the process. It might fix one problem, but then it creates another one. So of course, I'm more a fan of whole food stuff.
Right,
Yeah.
right. No, we've established that, I think.
Yeah.
You've been on the show enough. People that
Yeah,
listen on
right,
a regular basis, I
right.
think, are on board with that.
Yeah.
So your lifestyle intervention.
Yeah.
So how do you go and start making some of these changes that probably aren't going to cost you anything and aren't going to involve medicines?
Right. Yeah. Eating a whole food diet, it's not going to cost you anymore because you quit buying the processed food and you just switch to whole food. And people argue all the time how expensive that is. And I will definitely argue that it's not that expensive. In fact, it can usually save you money, especially in the long run if you look at your health complications. It involves time for sure because you have to shop, you have to follow recipes, you have to plan to cook. You can't just pop it in the microwave or the oven, okay? But definitely whole food diet and make it easy. Take it a step at a time, so maybe you just get rid of the chicken nuggets, for example, and you just incorporate whole chicken breast. Maybe after another little while you get rid of the canned soup, like the Progresso soups or whatever, and you start making soup. So chunk it off into workable, manageable goals, and you'll switch over eventually to a whole food diet in, maybe even 6 months to a year. That's going to be better than not at all.
Why is it not as convenient? You brought up the convenience factor. Mm-hmm. If it were more convenient, wouldn't more people do it?
Oh, for sure. I'm sure they would. So if you want convenience with whole foods, you can do that. You have to pay for it. Like you can buy pre-cut vegetables. You can definitely buy pre-cut fruits. You can even get to salad bars and things like that have that kind of stuff all laid out. Like there's some local grocery stores that have that option. It's just a little bit more expensive that way.
All right, we're going to continue talking about treatments for cardiometabolic disease. My guest today is Kari Collett, registered dietitian, A to Zinc Nutrition. It's Health Matters, and we're back after this. AM 1240, 95.3 FM, WJON. This is Health Matters, brought to you by WJON Medical. My guest today is Kari Collett, registered dietitian, A to Zinc Nutrition. Today we're talking about cardiometabolic disease. Okay, so moving on with different treatments. So we talked about exercise and changing to a whole food diet. Mm-hmm. Certainly, reducing stress. Mm-hmm. If you can do that, and those can be challenges because mm-hmm. there's so many mm-hmm. expectations. Kind of depends on what job you have. A lot of times your stress is related to job, but not always.
Yeah, a lot of the variables can be outside your control. So really the key is picking the items that are most stressful that are within your control. And sometimes it's just picking one small action step. So stress, I've heard, and this can apply to me sometimes too, is stress is fear of failure in the overachiever. So some people, we know them, they're not really stressed out at all, right? And other people are like, oh no, I got to get this done. I got to do that. And da-da-da-da-da-da. And those people are at greater risk of heart disease just for the very nature of their elevated cortisol levels. So as soon as we're able to name what that stressor is and apply one action step to it, already it decreases our stress levels and our blood pressure a significant degree. So that can be helpful in reducing stress, is just name it and give one action step to it.
Okay. So, you kind of change the way you think, though.
Right.
That's tough.
Yes. Stress is partly a thinking problem, if you want to call it that.
Right. I like this next one, spending time outdoors. Now, it's a little bit harder in the winter months, mm-hmm, mm-hmm. But certainly that can kind of put you in a better place mentally. Yeah,
absolutely. Nature is naturally calming. And especially if you can find some quiet time out in nature, you naturally meditate. Even though you're not formally, structurally doing it, you're allowing good energy and thoughts to come into your mind because you're just in a beautiful outdoor place for sure.
Right. Puts you in a better
mm-hmm.
headspace.
Yep.
How about reducing inflammation?
Okay. So this is my favorite part, Jay, because this is what I specialize in. So we're a fan of a whole food diet, but at A to Zinc Nutrition, we really focus on a very specific diet unique to each person's immune system. So not only are we eating whole food, but we're really working at that immune function. And then because of the immune function, we're able to reduce inflammation. So, you've heard this before, but we use the MRT food sensitivity test, and then we implement a diet that's different for everybody. For each person that comes in, they get something that works specifically for them.
Okay. Well, you can cater it to them depending
Absolutely.
on
mm-hmm.
what their likes and needs are, where they're at, if they want to lose weight, those
all
kind of things.
Above. Yep. We'll fix it. We'll create it for that person based on what they need and what they already know or don't know. Mm-hmm.
Do the majority of people walk around having food sensitivities and don't know what they are?
Well, everybody has food sensitivities, but not everybody responds to them. So I have food sensitivities. I've done the testing on myself just for fun, but I don't have any symptoms. Other people have food sensitivities, but they also have symptoms because their immune system is so overwhelmed they can't manage those.
What are some of the nutrients that a lot of people seem to be lacking? I know it's different for everybody, though.
Well, my absolute favorite to give to everybody is magnesium. But don't just go out and buy yourself magnesium, because if you don't understand it, it won't give you the benefit. But magnesium is a key player in every metabolic function in your body. So heart disease, hypertension, diabetes, you need magnesium. But other key vitamins, CoQ10 we hear a lot about with heart disease. B vitamins we hear about. Chromium is a element that supports blood sugar control if you're deficient in chromium. And then there's just so many others, but those are the key ones.
What do B vitamins do for us?
B vitamins help us convert energy, and they also are part of our DNA replication. They are also part of nerve function, so that they play a role in a lot of things. So that's why they're so critical.
I've heard about people getting B vitamin shots. What does that do for someone?
Oh, B12 shots. So yeah, well, and actually you can get all the B vitamin shots too if you want to. But so that allows for rapid entry of B vitamins into your system without having to go through the digestive system. Because if we go through the digestive system, we naturally lose quite a bit of that vitamin, and so we just have something that's more readily accessible when we do the injection. So.
Okay, tell me about some of the testing that can be done as well.
So the other test that I love to do in my practice is the micronutrient test, and that tells me what you're deficient in inside the cell from a 4 to 6 month period of time. It's a little bit different than what you get through your doctor who runs a serum test. But our newest testing is the cardiometabolic testing. Imagine the name on that one. So that one really very clearly gives me a picture of what all of your inflammation markers are, what all of your different lipoprotein particles are, so your cholesterol basically, but a comprehensive picture, not just what your doctor would run, but I get to decide or see what particle sizes you have. And then it also tells me what your omega status is. So omega-3 status plays a role in inflammation, and if I can learn what that is, I can tell you this is the fish oil you need and how much.
So in essence, it sounds like a lot of what you do is that you put people on diets that aren't going to cause inflammation.
Right.
So you just try to eliminate inflammation from the body.
Mm-hmm. And then we support it long term to keep inflammation away.
Right. Because all of us have to eat.
Right. Yeah.
It's just a matter of eating things that are not going to cause inflammation.
Right. Exactly. Mm-hmm.
That's we're never taught that stuff.
No. Yeah.
We were taught that there were 4 food groups and we needed to eat a certain amount from there and drink water.
Right. Right. Yeah. True. Yes.
But there was not very much more as far as specifics go. We're just smarter now than we used to be.
Well, some of us are, yeah.
I suppose not everybody's really taking...
Some people just choose not to be informed, or maybe they just haven't been exposed to it, or they don't have a motivation to become informed. I mean, a lot of it is motivation to learn it, too.
Any other strategies that we haven't touched on you wanted to bring up?
Well, if a person goes through a full comprehensive program with me and they still have markers that they're concerned about, there are other strategies like introducing herbs or spices and things like that that can offer additional support. Berberine is a common one. It's a particle in a plant that does reduce blood pressure. It does improve blood glucose levels, and it does improve your lipid profile too. So it's kind of a all-around comprehensive plant component, but we don't use it unless we need it, and most of the time we don't.
Kari, if people would like to see you and maybe make a difference for themselves and possibly get involved in cardiometabolic disease testing, how can they reach you?
They can go to my website, atozincnutrition.com, and schedule a free consult.
All right, Kari, thank you.
Thank you.
Kari Collett, registered dietitian, A to Zinc Nutrition. This has been Health Matters on WJON, brought to you by Rejuve Medical. We return next week at this time.